U.S. State Department segment. Today is the World Drug Day, the International Drug Day against drug abuse and illicit trafficking. And this day is, of course, celebrated every year on the 26th of June. This day was decided by the United Nations. And, of course, the body of the United Nations that deals with it is the UNODC. Now, the UNODC is the most important organism in Pakistan of the United Nations that works with on drug trafficking and on drug-related problems. To talk more about that, to talk about the importance of this day and the cooperation between UNODC and Pakistan on drug-related issues, we've been joined by a representative of the UNODC Pakistan, Jeremy Milsom. Jeremy, thank you very much. You have joined us.
Thank you very much. Thanks for having me on your program.
All right, Jeremy, I hope your stay in Pakistan is going fine because you've recently arrived in Pakistan. But let's talk shop, as we say. The UNODC, since when has it been the center of the fight against drugs and crime? And since how long is your organization working in Pakistan, to enlighten those who don't know much about it?
Well, okay, thank you. In fact, UNODC, in its current and earlier forms, has worked in Pakistan for over 40 years. And I think at the very start, that's a testament to Pakistan's strong commitment to countering illicit drug trafficking and its harmful impact on society. UNODC got the name UN Office on Drugs and Crime actually in 1997. When the drug and criminal justice bodies of the United Nations were merged into a single agency. So then for the last 23 years, we've worked here as UNODC, fighting against perhaps what you'd term uncivil society, which is illicit drugs, organised crime, terrorism and human trafficking, among others.
All right, Jeremy, this year the theme of the World International Drug Day is better knowledge for better care. Why use this theme and why use it this year?
Well, I think the world drug problem's been plagued by misinformation. And so we've made the theme of this year's Drug Day better knowledge, better care, just to emphasise that building knowledge, talking about it, sharing understanding will foster greater international cooperation and help counter the impact on health governance and society. The theme also capitalises and reinforces the World Drug Report 2020 as a knowledge product. It's something we produce every year and the base for everyday people, organisations, networks, businesses, civil society, the media, to share trusted, accurate information on the world drug problem, to spread science, clear messages, solidarity.
All right. Jeremy, also, you talked about the World Drug Report 2020 that has recently come out. Could you highlight some of the key points of this report?
Well, I think one of the key points that it shows this time is that there's been an increase in the global drug market's expanding. In this report, 35.6 million people suffer from drug use disorders globally. And if we go back to the 2009 report, around 269 million people used drugs in 2018. So that's up 30% from 2009. And while it is partly a reflection of population growth, which has been a factor, but there are many other important messages, and that is one, that illicit drugs, including illicit opiates, abuse of pharmaceutical opioids, cocaine, synthetic drugs such as methamphetamine are still more available, more diverse and more potent than ever before. They challenge our law enforcement responses. They pose very large health risks, and they complicate our efforts. That's perhaps the core message of this year's report.
All right. Jeremy, you've been to different countries. You've been in Afghanistan, you've been in Myanmar, you've been in Uzbekistan, in Pacific countries as well. And of course, now you are in Pakistan. What are the similarities as far as the drug usage in those countries and in Pakistan is? Are there any similarities, or is every country different?
Well, I think every country struggles with drug trafficking and drug abuse. And I think that's one of the important messages, is that it's a common problem facing our society. The people that traffic drugs, the criminals, don't recognise international borders, and so the only way we can work together, the only way we can solve it is by working together. UNODC, we have a three-tier approach. We work at the national level, regional level, and global level. So country by country, we work to strengthen the capacity of governments to address all stages of the drug abuse problem. But we also work between countries. We bring countries together to share experiences. To talk about, what approaches are working, what haven't, and to support each other. New drugs are coming on the market all the time, and this regional exchange of information, I think, is very important, because if a new synthetic drug, for example, comes up in one country, then through the international cooperation, we can quickly share information between countries, and they can look out for it. But it is a challenge. It's one faced by all countries. It's one faced by my own country, Australia. Each year in Australia, they dismantle home synthetic drug labs. We revise and work on policies to bring new messaging to youth and schools, and we share that information internationally and work with other countries. So all countries face the problem and need to work together and support each other.
All right, Jeremy, you talked about the usage of drugs in different environments, whether it be in schools, in societies, amongst different sectors and sections of society. Now, there are many facets to the people who use the drug. Let's come to the most important one that is prevalent right now, is COVID-19. Now, as we know, COVID-19 spreads very quickly between two people who are near to each other, especially if one has a disease. How important is also to counter this in the drug users all over the world, including Pakistan? What kind of measures need to be taken in your point of view?
Yes, well, COVID-19 is a challenge, poses an additional challenge to support those with drug use disorders. Again, it's a challenge the whole world is facing together, COVID-19, and we need to support each other and share information as developments come. But people with drug use disorders, well, there's a number of factors actually. They tend to have weak immune system and other comorbidities or illnesses, so it makes them highly vulnerable to COVID-19. Or to develop more serious forms of COVID-19. I think, as you know, also one of the challenges with COVID-19 is it's putting a lot of pressure on emergency medical services, which are being directed to respond to severe cases of COVID, and then more regular medical treatments, it's difficult to address them at the moment. So, currently in many countries there are limitations on admission to drug treatment centres, as it's not considered emergency treatment. Those who use drugs too often have financial problems. You'll find in Pakistan, as I understand, a lot of drug users source their income through begging on the streets. So there's limited access at the moment to pay for support, to pay for medical and social services, to access drug treatment and healthcare services. So it's a really difficult time I think that with the COVID-19, there'll be many suffering severe withdrawals on the streets without medical assistance. What we're trying to do now is we're working on, as with many other areas of where we working on trying to get treatment. But it is a very difficult time, and it's making the situation very difficult.
Jeremy, you were talking about cooperation with the local authorities. Now, how important and how effective has been the collaboration with the Ministry of Narcotics Control and the ANF in Pakistan?
Well, I mean, the ANF and Ministry of Narcotics Control are two of our very important partners here. We have excellent cooperation with the Ministry of Narcotics Control and ANF. We meet regularly, discuss the challenges in Pakistan and how we can work together. I mean, just to give you a few examples, we're working in partnership with the Ministry of Narcotics Control and Ministry of Health on helping establish a regulatory framework mechanism for drug treatment in Pakistan to ensure quality assurance of the interventions, to ensure they're in line with international standards, advocating for introduction of medical therapies. Those with drug use disorders can be treated with legal but controlled medicines. And there's so much work we do. We work in prisons as well. It's one area in relation to COVID-19 where UNODC's mandate is very important. And we're discussing this with working on this with the Ministry of Narcotics Control to ensure that there's protection in prisons, that those with comorbidities such as HIV prevention and treatment get the services that they need. So there's a lot of work we're doing, and the ANF, the anti-narcotics force. I mean, what we're finding in COVID-19 is that the drug trafficking is continuing. We're still having major seizures. And it seems some of the drug trafficking networks are seeking to take advantage of that. So it's what we need to do is work in the COVID-19 environment, continue to work despite COVID-19, and we work on many areas such as in intelligence-led operations. Protection and prevention, capacity building in many areas, and rehabilitation and awareness work as well.
Khalid, you talk of rehabilitation, Jeremy. One very important aspect is the psychological rehabilitation of the drug addicts. We have read, we have heard so many stories of the drug addicts that are alienated by their friends, family, and society as such. What is the role of society, in your point of view, in order to bring those who are affected by the drug usage, who are addicts, to come back to life, to rehabilitate them, to bring them back to society? How important is their role?
Yeah, that's a really good question. And I think to start, the important thing to point out is that, UNODC or the United Nations treats drug use disorders as multifactorial health issue. And in fact, that was agreed by all member states of the United Nations in the outcome document of the 2016 UN General Assembly Special Session on the World Drug Problem. And so drug use disorders need to be treated as a health issue and not stigmatized. We need to rally around and band together and support those that have these disorders. They're related to a complex interplay of factors out of the control of the individual. It could be related to genetics, mental health, environmental issues, socioeconomic vulnerabilities. So we need to support those in our communities that are afflicted, as a healthcare condition and not as a crime. And again, the way is, it goes back to the theme of today's Drug Day, which is better knowledge, better care. So if we all work with this understanding and reduce stigma and work, all of those that work in the field, be it policymakers, those working directly in medical or drug treatment, civil society organisations, government, all of those who have a stake to work together to address those afflicted.
All right, Jeremy. Also, there are, not only you talked about HIV, of course, there are so many other diseases that these the drug users get, and they need to be also taught and educated about the prevention from diseases that are very lethal to them, including COVID-19, including HIV, including hepatitis. Now, there's also another thing that they go up to. You talked about the drug users resorting to begging, but they also resort to different crimes in order to get the money for their drugs. Are there any measures in place in different countries, including Pakistan, to counter that and to help such people come out of it? Because, of course, they commit the crimes, but the nature of the crime, the backbone of that, the reason behind it is very different from other criminals.
Yes, sure. Well, again, if it's treated as a health problem and not as a crime problem, then we can better engage with the people, and they won't be afraid and can seek services. When I mentioned earlier, one of the things we're working on with Ministry of Narcotics Control and Ministry of Health, and that is medical treatment with medicines such as buprenorphine to treat drug users. Now, if they're in a healthcare, a medical program, and can then they don't need to resort to crime. Also, the survey done in 2016 found that 38% of those who inject drugs were also HIV positive, and many of those also are afflicted with hepatitis. So if people are moved into a medicinal treatment program, if people don't feel stigmatized and they feel they have a health condition and they can access services and be supported, then it also is crucial in breaking the vector of spread for those diseases. So it breaks the vector for the criminal activity, and it breaks the vector for the spread of diseases. And it's something which we need to address on medical fronts, not just the treatment and the psychosocial support.
Thank you very much, Jeremy Milsom, country representative for UNODC, giving us a detailed outlook of what his organization is doing in Pakistan, and of course to help the drug users. Drug users, ladies and gentlemen, are of course part of your society. Do not alienate them. Try to help them in whichever way that you can, because that is how they will become better citizens of Pakistan. We will end today's segment, of course, with a tweet by our Prime Minister Imran Khan, because today is also the International Day in support of the victims of torture. Our Prime Minister also addressed in AJK and talked about that as well. Let's refer to the tweet. He said, "Today, on International Day in the support of victims of torture, I call on